Good evening, everyone. Welcome, welcome. I'm excited for our virtual hangout tonight. I'll give everyone another minute, but welcome in. It's good to see many of you. We've had some great segments this week, so it's nice to see some familiar faces. I hope everyone's having a wonderful Wednesday. Feel free to use the chat to put in where you're tuning in from. I am tuning in from Philadelphia. Happy to be here as we make a little bit of a turn towards fall, so we're feeling a little bit more seasonal. And if you are new to our education events, let me introduce myself. So my name is Erin Pellegrin. I'm our Senior Director of Culinary Nutrition and Education here at Unite for Her. Not only do I work with amazing dietitians on our team, but I have the privilege of working alongside our founder, Sue, to lead these education events. So if you haven't joined us already, all of our past events have been recorded and are part of our UFH video library. So you can always check that out as well. So tonight we're talking all about keeping your crown, hair preservation strategies during cancer treatment. So we have the privilege of learning about both scalp cooling and cold capping, what those technologies entail, how you can have access to it, the success rates, and any questions with two experts in the industry. So we're really excited. And if you know that someone may benefit from this evening's discussion, it will be recorded and again posted in our video library. And I'll share that link once we get going with our first speaker so that you can tap into all of that. But before we move ahead, I do want to give a thanks to our education sponsors because we could not continue to bring important discussions without their support. So we are so grateful. Tonight's virtual hangout is presented through UFH Connect by West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and additional support from AbbVie, Tercera Therapeutics, and Verastem Oncology. So we are so grateful to their ongoing support. And while this is just our second education segment for October, we've got much more to come, which I will share with you in just a moment. Feel free to use the chat as we move along our discussion this evening. We will have plenty of time for questions at the end, and I'll be watching that as we move through. And as I said, our presentation will be recorded and shared. So for those that might find interest in this topic, feel free to share that as early as tomorrow. If anyone does need support with muting themselves because we don't want to be a distraction with our speaker, I can certainly help you with that as well. Now, some additional teasers, because like I said, while this is just our second segment of the month of October, we've got plenty more to come. So next week, we will be having another speaker series. That's Thursday, October 16th, 6 p.m. Eastern Time on Zoom. And our topic will be a shared journey, surgical insights and patient perspectives on male breast cancer. So we know with October being Breast Cancer Awareness Month, we are inclusive to all genders. And so really important discussion from a surgical perspective. I'll be joined by Dr. Susanna Nazarian from here at Thomas Jefferson, as well as joined on the panel with the Unite for Her member sharing his experience with breast cancer. So feel free to share that along. Again, that will be next Thursday at 6 p.m. Eastern Time. In addition, we have another virtual hangout happening on Wednesday, October 22nd at 5 p.m. And we will be joined by Revital Cancer Rehab. They are talking about moving with strength, enhancing mobility with metastatic breast cancer. So we know that this is a topic that so many members of our metastatic community have offered and suggested to really understand how they can improve their mobility. And we've got some of the best joining us that evening. So again, Wednesday, October 22nd, 5 p.m. Eastern Time. As always, if you can't join us, check out our UFH video library for that recording. All right. So with that being said, I think it's a good time to get started so we can jump right into our presentation. So let me begin by introducing our first speaker tonight. So Karin Buck is the Vice President of Paxman Scalp Cooling. She has been with the company since its FDA clearance and the launch in the United States, and she proudly brings this technology to patients all across the country. Karin is a breast cancer survivor who lost her hair during her treatment many years ago and knows firsthand the trauma that caused, and now the new technology that exists for side effect management of chemotherapy treatment. So please join me as I bring on our first speaker this evening. Karin, thank you so much for joining us tonight.
Oh, thank you, Erin. It's such a pleasure to be here. I've been a fan of yours and Unite for Her for years, and thank you for all the amazing work that you do and sharing of education. It's so important for us to support each other and to share this knowledge. So thank you for having us.
You're welcome. Thank you.
All right, so I will share my screen. As Erin said, I am more than happy to answer questions. You can put them in the chat and we will get to them at the end. And just really look forward to being able to talk to you all about Paxman scalp cooling and what exactly that is. Can everybody see the Paxman globe okay, Erin?
It just went away. Try sharing your screen one more time.
Oh, you were sharing this screen. That went well. Yeah, it always, just as you plan it perfectly. I had it on the right screen. Take two. We're going to edit this part out. Nope, just kidding. We're not going
That's
to do that
okay.
either.
It's not the first time or the last.
Screen two, share. And
There
now
we
the
go.
globe.
You got it.
Perfect. Thank you. All right, everybody, good evening. This is Paxman Scalp Cooling, and I'm going to walk you through exactly who we are, why we do what we do, and how we do it. You're seeing the second slide now, right, Erin? And I can see you nod if that's the case. Thank you. So our business is much more than just a job to many of us. As Erin told you, I am a breast cancer survivor, proudly treated at Penn Medicine, Dr. Angela DiMichele, my angel walking on this earth. But a story that started 25 years ago, a little bit more than that, in a village outside of Manchester, England, called Huddersfield. That is where Sue and Glenn Paxman were raising their 4 children, and Sue was diagnosed with breast cancer. That's a picture of Sue in the top with her puppy dog on her lap. Sue had very curly hair and did not want to lose her hair and asked for something less effective or some way that she would be able to not lose her hair. So they did offer an antiquated form of cold capping, which was literally ice on her scalp wrapped around an ace bandage. And honestly, it melted. It didn't work for her. And her daughter Claire talks about cutting off her hair with the orange handled scissors. And that was the first time Sue cried since her diagnosis, was when all of her hair was falling out from the cold capping that did not work. Her husband Glenn happened to have a family history in refrigeration. So he actually turned to the doctor at one point, Sue's doctor, and said, if this were a consistent temperature for a consistent amount of time, might it work better? And the doctor said, yes, I think it might. And Glenn said, fine, I'll build it. So 2 short years later, he and his brother invented the Paxman scalp cooler. It was installed at the University of Huddersfield Hospital. And that is where our story begins and our first patients. Our first patient actually was Sue. She had recurred at that point, and she was able to use the Paxman system that was made for her and start our journey. Unfortunately, Sue did pass away a little bit after that, but she is a living legacy. We talk about her every day. Thank you for letting me take a minute to talk about her. Her 4 children run the 2 different businesses. So Richard Paxman, her son, is our CEO. Her daughter Claire is our director of global training. And the other 2 kids run the refrigeration beer cooling business, which is actually what they did. They figured out how to keep beer cold instead of ice on a keg and then the ice melting. They invented the refrigeration line that chills the beer as it's coming out. And the 2 other kids run that company as well. That's called BrewFit. Everybody that works for the company goes over to Huddersfield, meets Glenn, sees pictures of Sue, and understands the meaning of what we do every day. So thank you again for letting me tell you a little bit about Sue. So what is chemotherapy-induced alopecia? Well, I'm sure everybody is quite familiar with it, and it is a hair loss that is caused by the damage of chemotherapy done to the hair follicle. It typically begins between 14 and 21 days after the first chemotherapy treatment. It is often the most feared side effect of treatment, and up to 10% of patients will refuse chemotherapy to avoid hair loss. Hair loss does not have to be inevitable anymore. Scalp cooling is the only proven treatment to help reduce chemotherapy-induced alopecia. And it is the patient's choice. It isn't the right decision for everyone. In reality, what we say when we're meeting with doctors and nurses, that we just want patients to maybe be able to have some control, to have some privacy, to be able to tell whom they want when they want. And if there is technology there, make it available to the patients. And as you heard me say, this started 25 years ago. So we have been scalp cooling for a very long time in the rest of the world, but our US story has only been a little bit more recent because of FDA clearance and all the things that the family went through to bring it here, which I will tell you about in a minute. Studies have shown that retaining hair can help to improve self-image and quality of life during chemotherapy, as well as providing a level of privacy around a cancer diagnosis, which I just mentioned. So what exactly is scalp cooling? Scalp cooling is a clinically proven treatment which can reduce hair loss caused by chemotherapy. A cold cap, which comes in two sections, an inner cap, it's a picture of it right here. It's a blue silicone inner cap, and it actually has a non-toxic salt-based coolant running through it. It is attached to a system that circulates that coolant through the cap, reducing the temperature of their scalp. There is an outer cap, the neoprene cap, which acts as a conductor, helps to keep that cap nice and cold and keep the hair follicles nice and cold. You might notice by the picture, the patient doesn't have any of the wet hair of the hanging hair. We never worry about the hanging hair. It's just the hair follicles you picture that we want them to stay nice and cold, and wetting them ahead of treatment helps to act as a conductor and help those hair follicles get and stay cold. On average, there's a 53% of chance of patients retaining 50% or more of their hair with scalp cooling. That is a very broad number. That is across all regimens, all stages. In reality, we see very good success with, say, a weekly Taxol. We see upwards of 80% of patients retain majority of their hair, much more than 50%. We just actually were in Massachusetts today for a state bill hearing on having scalp cooling be covered. And the patient that spoke there today so eloquently talked about her treatment. She said she does not believe she lost any hair at all, and what a difference it made to her. So again, every person's body is different, and metabolism and liver and all of that. So we can't guarantee it, but we do know the majority of patients, it absolutely works in retaining and protecting a very good amount of their hair. So how does it work? The cold cap needs to be worn for a short period of time before, during the chemotherapy drug infusion, and for a period of up to 90 minutes after. It will mean that you have to sit in the chair a little bit longer, the infusion chair. Depending on your treatment facility, they may move you out for those last 90 minutes where you sit there after the alopecia causing chemotherapy, or many hospitals might change the sequencing of a drug, or if you're getting a MAB or you're getting fluids or something like that, it's all happening at the same time, and you might not have to stay too much longer than you normally would have. The optimum temperature for the scalp to retain hair is between 64 and 72 degrees. So honestly, it's like a beautiful spring day. It's like a lovely fall day here in Philadelphia, frankly. It is not freezing the scalp. It is not uncomfortable. No patient left our FDA trial due to it being uncomfortable. Really, the majority of our patients find it, they actually thought it would have been colder. They thought it would have been more comfortable. And after the first 10 to 15 minutes, they really do get used to it. There's also been recent data, which I will show you in an upcoming slide, that talks about hair regrowth is faster. So that's why we say protect and retain. So what we mean by that is that we are protecting the hair follicle cell. So even if the hair strand does unfortunately break off, as we all shed hairs every day, and going through chemo could still dry the hair and could make it break off, that because the hair follicle cell was protected in cold, that a new strand can immediately start growing, as opposed to if you don't scalp cool, it takes many months after the alopecia, after the chemotherapy that caused the alopecia has been stopped. So that's the protection element. And then of course the retaining element is that we are trying to retain as much of the hair as possible. So who can scalp cool? Scalp cool is indicated and FDA cleared for use by cancer patients receiving chemotherapy to treat solid tumor cancers, such as breast, lung, prostate, ovarian, and gynecological cancers. There is no evidence to show scalp cooling is more or less effective with different hair types, and it can be used by adult patients of any gender or ethnicity. Outcomes will vary based on drug regimen and dosage, but scalp cooling is a valuable addition to treatment for those concerned about hair loss. I love this quote from Anna, one of our patients. "I could be as normal as possible. I didn't have to explain myself to anyone, and that meant I had control of the cancer, which was powerful for me and meant I could be positive." There are some contraindications. Really, the majority, hem-onc, so no blood cancers, CNS malignancies, small cell lung, and pediatrics as well. So, and these were FDA-guided contraindications. So the efficacy of scalp cooling, I won't get too in the weeds with. This is a lot of sciencey stuff, but it is, we have put so much time, money, energy behind the data. Our CEO, Richard Paxman, is very data driven, and he has, if you go on clinicaltrials.gov right now, you will see 4 or 5 different trials that we are sponsoring, all looking at different things all over the country. We did a first of its kind FDA trial to make sure that this was safe and effective and to receive FDA clearance. But the data here really is, as that's where it is, as I said, 80% with the weekly Taxol, docetaxel overall, we can see 73%. When you combine the T and the C, it's a little lower. Anthracyclines are a little bit harder, but we are seeing better results anecdotally from nursing staffs, and doctors are telling us patients that are on Keytruda, and so that the order was switched, so the Keytruda and the Taxol is done before the anthracycline, that shows a much greater response rate. The hair follicle cells either learned how to behave while they were on the Keytruda and the Taxol, so that when the anthracycline came, which is tougher, they knew to hide and stay cold and sleepy from the anthracyclines. Also, the cat preparation, patients got used to it, but we are seeing even better success rates when patients are on that, even though there's an anthracycline in the mix. This quickly shows the hair regrowth that I talked about. There's been 3 published studies now that shows hair does grow back faster. Both of these patients were on AC. This scalp cooling patient lost 50% or more of her hair, was considered grade 2 alopecia, but continued scalp cooling for her treatment. She didn't stop just because most of her hair had fallen off. And then it looked like, it took a picture at the end of chemo, grade 2 alopecia. 4 weeks later, she's already down to grade 1 alopecia with all that growth and length. And then 8 weeks after chemo, she's already at grade 0 alopecia. 12 weeks after chemo, grade 0 alopecia, compared to the control group that never scalp cooled on the same regimen and was grade 2 alopecia all the way till 3 months post, was still grade 2 alopecia. The only difference between these patients, same regimen, top patient scalp cooled and had that much more hair regrowth. So we don't want any hair to fall out, but we are a little bit feel good that we know we're protecting the hair follicles and a new strand can immediately start growing. Scalp cooling is safe, part of the reason why FDA cleared it, and it's on the NCCN guidelines and many worldwide guidelines. There was even a study done by Dr. Rugo out in San Francisco who showed there was no statistical difference in the incidence of scalp metastases between patients who have and have not received scalp cooling. Again, data, we are data driven. We are all about the facts and the numbers to keep everybody safe. Tolerability and comfort, less than 5% of patients discontinue scalp cooling across the world due to discomfort or intolerability. The first 15 minutes can be challenging, as I talked about. Our medical team advises drinking something warm, distraction, and deep breathing. And really, it's those first 10 to 15 minutes. Really, then you can quickly feel better. We also have a very robust Facebook group, 15,000 patients on there, current, former, all over the world, but majority are US, and they're incredibly supportive of each other, have pictures, give tips and tricks. It's a really wonderful place. We also did a study that we talked about the scalp cooling motivations, and these were the top 5: family, normalcy, privacy, identity, control. I had one patient tell me that she was attachment parenting with her 3-year-old, and her 3-year-old slept in bed with she and her husband, and her daughter twirled her hair to go to sleep at night. And as she was crying during time of diagnosis, she just did not want to not be able to provide that to her daughter. And she scalp cooled and was able to still provide that to herself and to her daughter. So the reasons are varied, but all beautiful, frankly. Again, scalp cooling motivations. How did this impact your life? And scalp cooling, 93% said it impacted their emotional well-being, social activities, work activities, relationships, and physical sporting. When we talk about success rates, we talk about factors that influence outcomes. So things that can't be influenced are, of course, the chemotherapy drug regimen and the dosage. Of course, that is the most important thing. That is non-negotiable. That is why we're here. That is why we do what we do. But we also know that chemotherapy has side effects, and many of those side effects can be managed. I had an infusion nurse tell me once that she's been doing it for so long that she remembers when patients would be in a circle in the chemo suite and they would all get sick, all be nauseous, and they would have buckets and they would just sort of run from patient to patient. The minute the IV went in, they would immediately start throwing up. Well, then there's Zofran and there's antiemetics, and now that doesn't happen anymore. That side effect can be managed. The white blood counts and Neulasta can be managed. Hair loss, scalp cooling, it can be managed. And then what can be influenced is a cap fit, to make sure the cap fits you great, to make sure that it's a close fit across the scalp, not tight. I didn't say tight, but I said close. We're trying to make sure we're covering all of those beautiful hair follicles, but not tight, because too tight can actually cause a little rise up or cause you to be uncomfortable. And then what can be influenced is the cooling times, making sure that the appropriate pre and post infusion cooling times are adhered to. And the reality is too, is that you have to decide if this is the right thing for you. I have many patients that say to me, I'm not going to do it because I don't want to sit in the chair for that extra amount of time. I would like to get home and be with my kids. Completely understand. Then there are beautiful wigs and great scarves and look beautiful bald. This is not for everyone. We want you to make the choice that feels best to you. 72% of patients reported hair loss was as or less than expected, which is good to hear. And sometimes caps don't always come down. Everybody has different levels of sideburns. So like there might be more loss around the sideburn that they wanted. So you can see this patient, again, it might be hard for some of you to see, but a lot of times too, top of head is the warmest part of the head. And that's why we see a little bit of greater loss up there. But the good thing too is that not only does it grow back faster, but a lot of people don't look at the top of your scalp. A lot of times you can do a kind of comb over or a little barrette, or maybe wear a little cap, but you still have all the rest of your hair so you feel like yourself. And we want your expectations to be managed too. I think I've been pretty clear. This is not a perfect solution in terms of it's an amazing solution, but you cannot expect to look the exact same the day you started chemotherapy. Managing that expectation going into this is one more tool in your toolbox is the right way to handle it. So capsizing, as I said, really important. This is what it would look like. Patients with type 3 and 4 hair, we've done a lot of research. There was a study at Georgetown on it. We're currently doing a study at Montefiore in New York on it. But what we know is that we need patients with type 3 and 4 hair to stretch the hair, as they kind of call it, and weigh it down in maybe a braid or a twist so that the volume doesn't push the cap up, or the volume doesn't keep the cap from making extreme contact with the scalp. So that's an example of how we'd like that to be. There's some more braids you can see. But all different hair types, we're very good at providing hair prep. The videos are on our website. They're on Facebook. We have patient liaisons that we are happy to meet with you. We've just hired our 4th former patient, which I'm really proud of. 4 different people across the USA that have sat in the chair, had chemotherapy and scalp cooled, and they're available on FaceTime, anything that you would need to support you during this process. As I said, we all shed hairs every day, even those of us up to 100 hairs a day we shed. And we absolutely will expect you to shed. And there's usually something called the big shed, but after that, it should really level off. And what we tell you to is try not to focus of what you've lost, focused on how much you still have. Hair care, we tell you to be gentle and careful with your hair. We don't want any coloring. We don't want a lot of pulling. We prefer you not get blowouts and all that kind of thing. Good hair care won't necessarily improve hair retention rates, but it can make the experience more pleasant and ensure that retained hair is in the best possible condition. So your infusion staff will help you on what to bring to your infusion suite the day of treatment. And you just need to bring your cap kit. It has everything you'll need with it: a water bottle, conditioner, forehead protector, the inside cap and the outer cap. We also suggest a nice scarf to wrap around you in case you get too cold, distractions as we talked about. And then we also ask you to please continuing on even if you have suffered a greater loss than you would have expected. So continuation is important. It really is about that regrowth period, and also trying not to focus on what has come off, really focus on how much is there and that the regrowth will be faster. As we said, we've done a lot of research for type 3 and 4 hair, and we know the good prep. We do not do the same prep. There's 4 types of hair for people that didn't know that, with many subtypes. So 1 through 4, and then there's 1A, 2A, 2BC, 4A, 4B, 4BC, and 3. Most of the times people know what kind of hair they are, but we want to make sure we have hair care instructions and hair prep for the day of treatment for patients with types 1 and 2 hair and types 3 and 4 hair. And at your infusion center, there's actually a QR code that you can watch the video on how to do the prep. And we also ask you to do that at home as well. So very quickly, last couple of slides, Erin, almost done. When we launched in the US, there was something called self-pay, which meant patients had to pay out of pocket. It's very frustrating for us, and we are frankly a UK company. So they're like, what do you mean everybody can't use it? And what do you mean people have to pay for it? And cancer doesn't discriminate. That's not, everybody should have access to this. So that was how we launched. But thankfully, between FDA clearance, NCCN guidelines, the American Medical Association issued CPT codes so that now there is coverage for scalp cooling. So your infusion center just has to switch to an insurance-based billing model. They will bill your insurance. And very proud, any of you from New York, please give yourself a hand. Your state is the first in the country, but many more to follow, that has just signed a bill that it will make, as of January 1, 2026, all large insurance companies must cover scalp cooling in their policy bulletins. So incredibly great. And as I mentioned, other staff of ours were up in Massachusetts today for a hearing on the same bill for Massachusetts. So there are 3 new codes that your company will send out, which will be great, your hospital. And then lastly, I wanted to make sure that you knew too that one of our patients wrote this amazing book. It's called Mom's Magical Crown. And since we are talking about magical crowns this evening, we just wanted to tell you this is available on Amazon. It's available at many hospitals around the US. But it was an explanation that Lauren wanted to do to her kids about why this meant so much to her, why she wore this funny looking thing on her cap and what it meant. And that normally chemotherapy attacks the hair, but by keeping it cold, that wasn't going to happen as much. And she has proudly written this book that we're really, really proud to offer to our patients. So if anybody is in need of a copy of that or would like to share, please reach out to Erin or put your name and address in the chat. I'm happy to send them as well. But that was everything that I had. I hope I answered your questions and did a little bit to share my love and passion for scalp cooling and everything that we do at Paxman. Thank you for your time.
I love that. Thank you so much. And um, funny that it's Amazon Day, I think, today. So if you wanted to get that book, because I think sometimes books are a great way to communicate with the young people in our life, and that can be a good illustration of, why someone may be experiencing that. So I love that you have that, but that was wonderful. Thank you so much. And I'm sure everyone is rolling with questions, but like I said, we'll have plenty of time at the end to talk with Karin and talk with Gina about any questions that you have. So thank you, Karin.
Thank you.
All right, wonderful. So, like I said, we have this keeping your crown discussion this evening, and we're so happy that there are options for patients everywhere, no matter the regimen that you're on, and you can decide what works best for you. So, I have the honor of also having Gina Arcuri with us this evening. So, let me introduce Gina. She was diagnosed with breast cancer in July 2020 and underwent a double mastectomy followed by chemotherapy. She would have lost 100% of her hair, but was able to keep almost all of it due to her capping with Penguin. Her experience inspired her to become a cold cap therapist, and she's been a cold cap therapist consultant with Capping Partners of America since 2021. So it is my pleasure to now bring on Gina Arcuri to talk about cold capping. How are you? Thank you for
Hi,
joining us.
good. How are you? Thank you for having
Good.
me. Um,
Absolutely.
yes, I'm excited to share my experience. I was diagnosed, like you said, back in 2020, and it was very stressful. I have 2 children. So for me, I didn't want them to view me as sick. So for me to keep my hair, I really wanted, I really wanted to keep my hair. I just happened to stumble upon cold capping. I never even heard of it. And so I did a little research. I stumbled upon Penguin cold caps. Um, and then when I reached out to Penguin, they told me about Capping Partners of America, which is who I work for now. So they trained me how how to cap. So I can go over some of the pricing, success rates, all of that. I will share my slides. Okay,
Yeah.
so this is a picture of me. It was during COVID when I was diagnosed with breast cancer. So this is what the Penguin cold caps look like. Um, you have to put the caps on 50 minutes before chemo. So you pre-cool the head for 50 minutes before the first infusion. I did Taxotere Cytoxin 4 rounds of that. So you cap for 50 minutes, then you cap all through your treatment. And then you also have a post cooling time. And that's individualized based on your treatment, based on your hair. What you will do is you fill out like a little survey with your hair type, what treatment you're doing, and then Penguin will give you your individualized schedule. So based on that, it's usually between 4 and 5 hours after your last chemo drug that you continue to cap. So the post cooling time, helps just because, the chemo is still going through your system. So here is my story. So my hair I pretty much kept all of it. A little bit where I did lose was right near like my ears right here. I don't know if you could see see me as well, but near my ears is where I lost a little bit. But a lot of people that didn't even know I was going through chemo, didn't even know because you couldn't tell. So that's a picture of what my hair looked like after. So I pretty much kept everything. And so right as soon as I was finished, I knew I wanted to help others. I was shocked at the results. I was very pleased that I was able to keep my hair. And, you know, um, but here is another picture. I now work for Capping Partners of America. So when I do train others how to cap, that's actually my son. So I will cap, show others how to cap through like a Zoom meeting, just like we're doing, and go over everything, packing the cooler and the whole rotation of the caps, um, dry ice, all of that. And then I'm also available, um, throughout the whole entire chemo process. If they have any questions, they can call me, email me, or even afterwards, because you have to continue with hair care for, 3 to 6 months after chemo as well. We recommend using paraben sulfate-free shampoos, and things like that. And those are all things that Capping Partners of America consultants, that's what we go over as well. There is also an option with Capping Partners of America that we can go to the facility and cap you if that's what you prefer over training. But there's all different prices for that as well. So I will actually share the success rates and for Penguin, and then some pricing. So I'm just going to share my other screen.
We can see it.
Okay. Oh, you can still see it. Great.
Yep.
Okay. So with penguin cold caps, on average, users of penguin cold caps retain an impressive 60% to 90% of their hair. So when it comes to minimizing hair loss, success does come down to a number of key factors. These include ensuring the caps are properly fitted, wearing them for recommended duration, and caring for your hair during and after your cold cap treatment. So it says, if you follow your penguin reps instructions closely, you too can successfully minimize hair loss. That's why, I would recommend getting either trained through Capping Partners of America, or, if you don't have anybody to cap you, having someone come to cap you. And then here's the cap, evidence of success. Um, so I do have, I don't know if we could share, but the Penguin Cold Cap website, but, up here we can do success rates. And then also, whoops. What it feels like. Okay. So, while the caps are cold, many patients tell us they expected them to feel far worse. And in my experience, I expected it to feel a lot worse, because the temperature that usually, again, everybody has an individualized temperature, but it's usually between -28 to -33 degrees Celsius. We put the caps on ice for 1 hour before we begin the pre-cooling process. So that's what we need the caps at all times. So each time we take a cap out, we check the cap with a thermometer, whether you use the thermometer that's in the Penguin kit, or you can get a infrared thermometer like on Amazon, to check the temperature. So we want to stay at around between -28, -33 degrees Celsius. Um, but for me, maybe the first 5 minutes felt cold. After that, I just pretty much was used to it. I wouldn't say it was painful. Everybody asks me, is it painful? I wouldn't say it was painful. It's just cold. I don't like to be cold. So I always give, tips during my trainings. I brought a heated blanket, extra blankets, a robe, just things to keep me warm. If you want to drink hot coffee, things like that. Um, and the other thing I wanted to go over was pricing. So this is for the Penguin cold caps. The standard pricing is $389 per month, and then it tells you what it includes, which are the Penguin cold caps, the 3 gel headbands, the forehead protector, thermometer, 2 black straps, 1 gold strap, pair of gloves. And then you could choose to do the Premier, which is $419 per month. And that also includes the cooler. You can choose to get a 60-quart cooler on your own. Usually they have them at Walmart or something like that. And then if you do decide that, you want extra services, training services, that's what I do. You could either choose from the in-home training. So this is through Capping Partners of America. We work with Penguin. So you could do the in-home training, which the description is, let me just make that bigger. So if you prefer a hands-on approach, one of our cold cap technicians will come to your home to train you and your chosen support person on best practices for cold capping. This session includes full demonstration, step-by-step instruction, and time to answer questions, ensuring you both feel confident in delivering optimal care and achieving the best possible hair preservation results. And then what's included, you get 4 hours of hands-on in-person training, complete walkthrough of the cold capping process, dry ice support, treatment day on-call service, hair care overview, list of recommended products. And then the pricing for that is $400. If there isn't a representative in your area, then travel fees may apply. And then the if you could choose first treatment on site. So you would have a capper join you the morning of your first treatment to guide you through the process and train a family member or friend to finish the day. The package includes scalp prep, pre-cooling, the cap rotation, and proper cap changing techniques. So this would be a more affordable way to get started with support while you're empowering a loved one to carry you through the rest of your capping journey. And everything, cold cap specialist will attend the morning of your treatment, 4 hours of hands-on in-person training at the facility. Cold cap specialist will train your family or friend, dry ice support, hair care guide, and list of recommended products. And then the pricing for this one is $400. The cost of dry ice will not be included because the technician would go get the dry ice as well the morning of or the night before. And then also travel fees may apply if the technician, if you don't have one in your area. And then if you choose virtual training, you would receive, same kind of guidance. It would just be prior to your treatment. And a technician will host a live video conference with you and your support person demonstrating proven techniques for scalp prep, cap changing, and cooler rotation. This remote option is ideal for families who want expert help without the added cost or logistics of in-person training. That's the one I chose because it was definitely more affordable. So I'm going to show you the pricing for this one. So this one is $200. And you wouldn't have to, obviously you would not have to pay for, I don't know why that says travel fee on there. There wouldn't be a travel fee. But this would include 2 to 3 hours of one-on-one virtual training. And we go through the complete walkthrough of the capping process. I also share videos of how to prep the head, how to pack the cooler, how to actually cap. I go over all resources, hair care, and then I give dry ice support if they need, recommendations for where they can get dry ice. And what we do recommend are pellets, pellet form. And then again, I'm available to them throughout this whole entire process, whenever they need me for any questions or support. And that's pretty much it. I think I pretty much went over all of this, what's involved. And then we went over all of the in-home training, first treatment on site or virtual training. And then here's contact information for Penguin Cold Caps and Capping Partners of America.
Perfect. And I did share the link to the website in the chat for you.
Okay, perfect. And then if anybody has any questions, are we going to do that at the end?
Yeah,
Okay.
absolutely. We have some questions in the chat already,
Oh,
which Karen has been answering as well. But I think it's a great time to jump in with some discussion and questions. I certainly have some questions myself, just inquiring about that as well. So Thank you both. This is really wonderful. We have a lively chat already with lots of questions, which is great. I think we knew that would happen because this is, there's a lot of, I think, illusion almost behind it. So I love, Karen, what you said, just really setting expectations on what to experience. So I would be curious, Gina, for cold capping, is that covered by insurance? We had a question about Medicare as well. Is that something that a person could submit for reimbursement? You're muted. Let's have you unmute.
Sorry about that. So yes, you could submit it into your insurance. They could reimburse you afterwards. Um, it's not a guarantee, but you can do that. Um, a lot of times they say you have to continue. Sometimes you have to kind of keep on it, um, keep, calling them and making sure the paperwork goes through. But that is something you can do. And there are also some resources like Here to Stay, and things like that that can help with the costs.
Okay, wonderful. And a great question in the chat, just in terms of about putting it on yourself, and certainly initially, if you have that training to help do that. Karen, I said, I see you both. The nursing team supports you. Others can help with it. Gina, is that something that hospital staff may also be able to help a patient with? Placing a cap on their head, or just making sure that it's positioned correctly and close enough to the head that it gets full effectiveness?
So that's not something, we've asked a nurse. That's not part of their, I guess, qualifications. They don't need to be doing that. Um, but if, that's why we say, prior to your treatment, you could either choose to be trained and have a loved one, a family, a friend, do it. And then as, if we train them, we go over it. We watch, they actually hands on, we watch them do it, make sure they're doing it correctly. I share a video of how to put the cap on correctly. So, they're either prepared that way,
Right.
or they can have someone from Capping Partners of America come to the facility and cap them.
Right. Okay. And I'm just curious, as I listen to both of you, sort of thinking from the start when someone has a diagnosis, and Karen, you and I were talking a little bit about this early on, that decision, or in your experience, how do patients hear about these hair preservation methods? Are they expected to hear from their oncologist or nurse navigator team? Is it something that a patient should reach out to a company in particular or an organization specifically? What's your recommendation in terms of getting connected with this type of therapy or service?
So, I would, do your research, go online. But, as far as I've had some clients in the past say, some doctors said, oh, this capping will not work with, the chemo that you're using. And sometimes if they're misinformed, because I've seen where, I did Taxotere Cytoxin, and sometimes with Taxotere, some people, lose their hair, um, and, have trouble with it coming back or whatever. And I was able to keep it. So I don't know. I think that, how do I want to say this?
They may reach
I
out
want
on
to give
their
them some
own.
kind of,
Or,
yeah. So I would have someone contact Penguin, or contact, if it's coming through, because I only know through Penguin, because that's my experience. So if you
right.
were going to go that route, you can contact Penguin, and then they would set you up with training if you decided to that you wanted training.
Right. So what you're saying is usually a patient would reach out on their own to inquire about this service. Karen, is that in your experience as well, or is it usually through an oncology center? How might someone get connected?
Yes, we are offered only at oncology centers, at hospitals and infusion centers, so patients can't contact us directly to get a system
Okay.
there or anything like that. So it has
Okay.
to be sort of prescribed by the doctor, and also with insurance, because they're CPT codes, the CPT codes
Yeah.
are only reimbursable back to the hospital. So the
Okay.
hospital has to do the billing, which is why the hospital is involved in the introduction of it. The hospital does a sizing visit, which is one of the CPT codes. And then also for the extended chair time, the hospital does that, which is why I had answered it's both, because the medical team is completely involved. The doctor recommends it or suggests it, and then the nurse does the fitting to figure out what size they are and then gives them the cap kit. And then
Okay.
every time they're in for treatment, the nurse, the medical professionals have to be involved. They push the buttons, they support the patient, they drop another CPT code, which is why they have to be the ones doing it. But absolutely, there
Got
might
it.
be a little adjusting or something that absolutely the patient should be well informed and have, a chemo buddy there or somebody else that helps them along the process. Absolutely. It's all hands
Okay.
on deck. Whatever the patient needs, let's support them and get them through this.
Okay. So a patient would want to inquire if you were associated with their hospital center, with their oncology center already. Does that relationship have to already be established?
Yes. Yep.
Okay.
Yep.
Okay. Okay. So now we know if that isn't the case, there are still options for patients out there. So that's really great. And
Absolutely.
we had a really great question in the chat just about post care. Kathleen had mentioned just finishing up and she's interested in learning about scalp and hair growth post care. I love, again, to have both of you sort of talk about what you recommend once a person is done their treatment and really just the care that goes into ensuring quick regrowth, adequate regrowth. What do you typically share with your patients?
So as far as regrowth and things like that, I'm hoping that really didn't lose much. We do say that you may see some shedding. With shedding, though, it's kind of like when you would brush your hair, and how you get a little bit of hair in your brush. That's kind of what when I say shedding. So it wouldn't be coming out in like clumps. Um, but as far as post chemo hair care, we recommend to continue for 3 months with a lot of things. So, no chemicals, keeping, because we recommend when we wash your hair, washing your hair with cool, cold water. Continue doing that for like 3 months, maybe even 6 months. And then you just kind of go a little bit warmer. Continue with paraben sulfate free shampoos. Um, and then, no heat, no blow drying, no chemicals, no dry shampoos, things like that. Um,
Okay.
as far as like coloring your hair, I would wait 6 months.
Yeah.
Chlorine, things like that, avoid. So those are all things. And these are things that we go over as well during the
Yeah.
training.
Good.
Yeah.
Yeah, we're similar. I put on there, although we haven't tested the need for the cool, cold showers. We're asked it often, but we're just like, we
Yeah.
want them to be comfortable, but nothing scalding hot, no jacuzzis, no color treat, really being incredibly gentle. That's the way we talk about gentle, just nice and gentle, but of course, keeping up with the brushing and get any of the
Yeah.
shedding out. But yeah, nice and gentle, just like you need to be with yourself. Give yourself lots of grace during this
I
time. And
know.
that's all part of it. And your crown, keep
Yeah.
your crown in place. Let's keep that on us.
I know, I know. I always think of we did a segment with our beauty advisor just about supporting overall hair growth and she mentioned really thinking about it from the scalp out, right? Like really taking care of it from the scalp out and even just a little extra massage gently in the shower just to help with blood flow and oxygen and just a little extra just to really help with stimulation and I love what you said just being gentle with yourself, gentle with your hair and your crown and just keep plugging away little by little and taking care of it. And hopefully you start to see those results.
Yep.
We did have a question, which I'm glad, Mara, you asked, just about for the cold capping, you mentioned temperature in Celsius. So it's 0 degrees Fahrenheit, so significantly cooler. Um, It ranges. Can you give that range in Fahrenheit for those of us that are not good with the metric system?
Good question. I'm gonna look that up because I don't know the answer to that. Um,
Okay. But I think there's a little bit of a temperature difference there. So certainly something to consider, a sensitivity to that. But, I love that they make heated blankets and there's lots of warm beverages and lots of suggestions for keeping warm as well. And I will say we have a small group. So if anyone has any pressing questions, we've got just a couple more minutes. If you want to come off of mute and ask Karin and ask Gina any of your other pressing questions, you're welcome to do that or share your experience with cold capping, with scalp cooling. Like I said, I love that these are available and becoming, we're hearing in the news, becoming more part of the conversation so patients can ask about it early and they start inquiring about it from the get-go.
And I just looked it up. So negative 18.4 degrees Fahrenheit would be negative 28 degrees Celsius.
Okay. Get those warm blankets.
Yeah.
Lots of layers.
The heating blanket that definitely helped.
Yeah. We also had one other question about the weight of the cooler. So if it's something, Gina, that you're bringing in
Mhm.
versus something that might be stationed at the hospital, can you talk a little bit about the weight or what it may take for someone that's bringing that with them?
So yeah, so the cooler has, if you get the one from Penguin, has wheels on it. If not, I
Hmm.
would recommend to get one with wheels, which makes
Hmm.
it easier. Um, you would have 50 pounds of dry ice, and then the caps. So these are the caps. You'll have 3 of these caps in there.
Okay.
They're
Oh,
not too heavy.
okay.
Um, and then you'll have 3 bands in there as well.
Okay.
So you'll have
Yeah,
about
having that easy transportation is good.
yeah.
Okay.
Yeah, so I was able to, get the cooler in and out by myself.
Yeah, great.
Yes.
All right, wonderful. I think that's all the questions I'm seeing in the chat. If I missed any, please let me know. And again, we've got another minute or so left with our speakers this evening. So if anyone has any final questions before we wrap, or Karin, Gina, if you have anything else you want to share about connecting or putting contact information in the chat, by all means, please do so. I think this is a really good resource just to continue to share and educate on.
Yeah, agreed. Thank you so much. And anybody that would like to advocate for this with your state assemblyman, or it literally, as I said, was a patient in Massachusetts who got it on the Senate bill to be on the Senate floor today for her to advocate for it. And in New York, the bill was introduced by a city assemblywoman who knew somebody that had scalp cooled and heard that they had to pay thousands of dollars out of pocket and was horrified, and they had perfectly good insurance. So she's the one that brought the bill forward in New York State. And Louisiana just passed it, and we know there was a hearing in Maryland. So if all over the US, if you want to ask somebody in your state legislation to take this up, we agree it's important side effect management and it deserves to be covered.
Yeah, wonderful. Keep sharing. Start the wave, as we say. This is just the beginning. Start the wave of
Exactly.
this. Yeah. Wonderful. Okay. Well, if no other questions, I will thank both of you for being here and just sharing the incredible work and research and products that you give to the cancer community. This hair is a big part of a person's identity, and you allowing someone to preserve it and allow them to have a little sense of self and normalcy in a time that is so chaotic, I think is really fantastic. So thank you both for the education and the work and the resources that you provide and offer to the community.
Thank you, Erin. Thanks for
Thank
having us.
you.
Nice to see you, Gina. Thank you,
Nice to
everybody.
see you as well.
All right, wonderful. Well, thank you so much all for joining us this evening. As I said, I put my email. If you have any questions afterwards or as you're sort of reviewing this information, you're welcome to pass them along to me and I will forward to the appropriate person. We are recording tonight's segment as well. So if you want to come back and sort of go through those slides or listen to what our speaker said or share this with someone that may be at the start of their chemotherapy or perhaps having to start a new regimen and this is a side effect, please share this with them. Like I said, it's good to know that there are resources available just to allow someone to feel a little bit, maintain their sense of self. So I'm glad we have this to offer. Again, hopefully I will see many of you at some of our future education events. So next week we have our speaker series, October 16th at 6 p.m., a shared journey, surgical insights and patient perspectives on male breast cancer. So please share that for those, men get breast cancer as well. So we're really happy to dive a little bit more into the surgical aspect about what that entails and new technologies around those procedures, followed by our virtual hangout Wednesday, October 22nd at 5 p.m. This is all for our metastatic community. Of course, it's good for all of us, but we will be joined by Revital Cancer Rehab talking about moving with strength, enhancing mobility for metastatic breast cancer. So that's October 22nd at 5 p.m. And of course, they're all recorded in our UFH Connect video library, and we could not continue to bring you these education events without our sponsors. So I want to take one more moment to thank our education sponsors. Tonight is presented by West, Merck, Lilly, Novartis, and Gilead Sciences, with additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, with additional support from AbbVie, Tercera Therapeutics, and Veristem Oncology. So thank you all for being here. Enjoy the rest of your night. Hopefully I will see you perhaps in the kitchen, and if not, at a future education event. Everyone take care and be safe. We'll see you again soon.